you. Chairman Wenstrup, Ranking Member Ruiz, and distinguished members of the subcommittee, it is an honor to be here with you today. I came to CDC in January of 2021 as a practicing infectious disease doctor and researcher who had been on the front lines of the pandemic treating patients with COVID-19. I leave later this month with a great sense of accomplishment that the public health emergency has ended, and with an unwavering respect and admiration for the dedicated people across CDC working every day to protect the health of Americans. When I started, CDC faced enormous challenges. For example, the sharing of data was too slow and often relied on fax machines, which greatly hindered federal, state, and local leaders from having timely access to critical public health data. As a nation, we have mourned the loss of more than 1.1 million family members, neighbors, colleagues, and friends from COVID-19. And we cannot lose sight of the fact that we are still losing people to this disease every single day. But thankfully, we are in a much different place today. The end of the public health emergency last month marked a tremendous transition for our country and for public health. Now we have the tools we need to protect people in our communities from severe infection and death. Thanks to the work of CDC, our partners in state and local government, the private sector, and frontline healthcare workers, more than 676 million doses of vaccines have been administered across the US, saving millions of lives. These vaccines built a wall of protection which dramatically decreased the risk of severe disease and death from COVID-19. When I started at CDC, just 1/3 of school districts were offering daily in-person instruction. With my 3 boys at home with me, getting schools open was a top priority for me. I, like many of you, recognize the critical role that schools play in supporting social, physical, behavioral, emotional, and mental well-being of our children. In fact, one of the first guidance documents released by CDC just 23 days after I started was the operational strategy for K-12 schools through phased mitigation on February 12, 2021. This roadmap to reopen schools and help them remain open was the result of countless work hours by CDC staff, along with feedback from over 50 organizations and implementing partners. Organizations and individuals whose engagement we needed, whose participation was essential if school opening was actually going to happen. And it worked. By the fall of 2021, nearly every school district in the United States offered daily in-person instruction. Throughout my tenure as CDC Director, I used the best available and often emerging data to inform real-time policy decisions. Rarely did we see new scientific findings that were immediately and unanimously clear and consistent. But at CDC, we have a strong commitment to acting quickly with transparency when new science gives us better ways to protect the public health needs of our most vulnerable. For example, when 2 studies were released in March of 2021 showing that we could reduce physical distancing in schools from 6 feet to 3 feet, we acted to release new updated school guidance just 4 weeks after our initial effort. Fortunately, today we know so much more about this virus than we did when it first emerged. And in 2023, we believe the darkest days of this pandemic are now part of our history. Despite important accomplishments and improvements to our public health lab capacities, expanded ability to collect and share high-quality public health data, and bolstered public health infrastructure, CDC still has more work to do, and I am deeply motivated to make improvements based on what I had seen. I launched an all-agency review, CDC Moving Forward, in April of 2022 to address the lessons learned from COVID-19, increase accountability, and improve how we deliver information to Americans. As CDC continues this internal work, we need partnership with Congress to better position CDC for success. In closing, the rate of infectious disease threats that I have seen as CDC Director should be a warning to us all. As a nation, we failed to heed the lessons from previous disease outbreaks. We are once again faced with opportunity. Collectively, we should focus our work on moving the agency and public health forward. Our response to the next infectious threat relies on how we come together and have productive conversations about supporting a more prepared America. I commit to further this goal in my last weeks at CDC and beyond. It's too important, and too many lives are at stake. I hope you will continue to work with me and CDC to support sustainable public health investments and updated authorities that will protect the security of Americans by being better prepared for tomorrow's health threats. Thank you, and I look forward to your questions.